Hi, everyone. Welcome to our session, The Reproductive Health Rights of Youth in Care and What Adults Must Do to Support These Rights. I am going to get started right on time because we have a lot to cover, and I would love to be able to cover as much as possible and leave some room for questions and answers. Hopefully, if others will join us, they'll just jump right in. My name is Luciana Spidler. I'm a senior policy attorney with Children's Law Center of California. And with me is Lola Barber. She's a peer advocate at Children's Law Center of California, and she'll be talking a little after my slides. Now, I mentioned we have a ton to cover. I would love to cover as much as possible, but I don't want to hold you back. If you have a question that's directly related to something I was just saying, you can throw it down on the chat, and our room host will flag me with the question. If you think it can wait till the end, go ahead and either put that in the chat or wait till the end. And as always, my information is in the back. So if I don't cover or answer any of your questions, you can always reach out to me via email or telephone. I'm always happy to talk about these issues and provide any support possible. So with that, I would love to get the slides moving and tell you our learning objectives today, which are: one, to explain the reproductive sexual health disparities for youth in care. This is just a little background to kind of set the scene. Some of it you might have heard in other sessions, so I will go through these slides quite quickly. The most important thing for me to cover with you is the reproductive and sexual health care rights of youth in care. And along with that, the duties and responsibilities of the social workers, probation officers, and caregivers in supporting these rights and the healthy sexual development of our youth. So just to give you a little background, California has a very rich network of sexual and reproductive health information and services. You can see from this slide, we have mandatory comprehensive sex ed in school, middle school and high school, one of the most comprehensive required curriculums in the country, actually. We have consent rights that allow our adolescents who need care to get it confidentially. We have a network of very reliable clinics. We have public funding. The state pays for all of these services if they're not otherwise covered. We have trustworthy information for teen and adults, just really everything you could hope for our teens, our California teens, not just, I'm not talking here just about foster youth. And as a result of this, we have had over the years one of the biggest reductions of teen pregnancies seen in the country. We've had since 1990, since 1991, we've had 77% reduction in teen pregnancy, which is awesome, right? However, this doesn't translate to our youth in care. So even though the overall rate of teen pregnancy in California has drastically decreased, our youth in care are still getting pregnant at much higher rates. So if you look at the slide, by age 17, 26% of youth in care will have been pregnant at least once, as opposed to 10% in the general population. And by age 19, 49.30%, that's almost 50% of youth in care will have been pregnant at least once, as compared to 20% in the general population. Also good to note is that of the youth, the 17-year-olds, 22% have been pregnant at least 2 or more times. Now, some people say that the reason for the increase in pregnancies in foster youth, or the difference in pregnancies in foster youth as opposed to the general population, is this idea that foster youth are seeking to get pregnant because the narrative that you hear a lot is that they're looking forward to build their own family, to someone to count on them, someone to love, to be able to provide and give their children what they didn't have. All very legitimate reasons. However, that's not true for most of these cases. So in a study done in 2014, about 70% of the females who were pregnant at age 17 did not intend to get pregnant. And of the men who got a female pregnant, 66.6% did not intend to get someone pregnant. So really what we're talking about here, and this is what I was talking to Lola before you all joined, is we're not talking about preventing pregnancies of those youth who are seeking to get pregnant, and that's their choice, but we're talking about how do we avoid this unintended pregnancies and ensure that the youth are able to have the future that they envision without this. Also disparities besides pregnancy, you see disparities in STIs among youth in foster care. For young women, 44% of women by the age of 16 will have been diagnosed with an STI as opposed to 23 in the general population. And the numbers are a little more equal in the men's side, not quite sure why. And of course, we know that there are some consequences of having children early on for our foster youth, and some of the consequences and the outcomes are related to education. By age 19, of those who haven't enrolled in higher ed, 30% cited the need for childcare as the major reason why they haven't returned to school. So it affects their education. Also money. By age 24, having a child reduces a woman's odds of being employed by 30%. That's holding education attainment constant. That means that if you're looking at the same, at two women with the same level of education, if they have had a child, they're less likely to be employed. And finally, children born to foster youth are 3 times more likely to have a substantiated report of maltreatment by age 5 than children born to the same age youth not in foster care. And I don't say this because I want to imply in any way possible that youth in foster care are not able to parent their children, but we do know that their kids come into the system more. You have to keep in mind that youth in foster care have all kinds of folks looking, and watching their every move. They're being watched by the court system, by the social worker. They already have involvement. They don't tend to have the same support, system and kind of trusted adults to help out, or, just the same community to assist with the child rearing either. So you can see the outcomes, and unfortunately, I've shown you some of the consequences. Now I could do a whole training on, the disparities and the consequences, but just to give you a little background of why it's really important to learn about the rights of youth and also what all the adults involved in the foster youth life can do to support them. So we're going to go into the sexual and reproductive wellness rights of youth in care now. All of the rights that I'm going to talk about are printed in this pamphlet that's distributed and published by the California Department of Social Services. This pamphlet was put together by a group of advocates, agency folks, and also youth. So it's very youth-friendly. They've reviewed it to make sure that it's in a youth-friendly voice. It's available in Spanish. It's available in a host of different languages. And most importantly, it's available. I have the website on the slide. You can look it up, and it's available in printable form. So if you can't get to CDSS to send you guys copies, you can go print out a version. It's a great pamphlet to use yourself to know the rights, but also to use with the youth as you are explaining the rights to them, and to also give it to them so they know what their rights are. If I can have everyone mute, that would be really helpful. I hear some typing, and it's just, I want to make sure it's not distracting others. Thank you so much. Okay, so the first set of rights that I'm going to go over are rights of all youth in care, of all youth in California. I'm sorry, they're not specific to youth in foster care, and all of these rights also belong in the concept of in the doctor's office. So number one is the right to consent or decline minor consent care. So youth have the right to consent or decline consent on their own behalf for the prevention or treatment of pregnancy, including contraception at any age, an abortion at any age, diagnosis and treatment of sexual assault at any age, and the prevention, diagnosis, and treatment of STIs and HIV at age of 12 or older. I'm sorry, I think someone needs to mute themselves.
Stands on a height of 5 feet.
Thank you. So this means, for example, if any youth in California, not just the foster youth, would like to get an abortion at any age, they can do so without needing consent. They could just go to the office and request it themselves. That means they don't need consent from a parent, caregiver, guardian, social worker, probation officer, or the court. Now, this is something that we hear a lot, because youth are in care, are supposedly under the watch of the government agency. A lot of people think, well, they can't do it without approval of the social worker or the court, and this isn't true. This group of services that I described earlier, they do not need any permission. Also, the provider, the doctor or the nurse, medical provider can't require consent from anyone else but the youth. So the doctor can't, ask the social worker or the caregiver, is it okay if I put an IUD in this youth? They have to ask the youth directly. And the provider cannot provide care without the youth's consent. So I recently had a case where the caregiver was asking the doctor to put in an IUD on our client who was sexually active, and the provider cannot do that without the consent of the youth. Youth in California also have the right to privacy in exams. So they have the right to privacy for examination or treatment by a medical provider unless the youth specifically requests otherwise. So this is actually common standard. The American Academy of Pediatrics recommends this for all children. When they get to a certain age with your own child, if you take them to the pediatrician office, there comes a time in the appointment where they'll ask the parent to leave the room so they can have some alone time with the youth or child, so they can be free to ask questions and answer freely. This is the same for youth in care. Again, an area where we see a lot of pushback. A lot of times, whether the provider thinks that it's okay for the social worker, or maybe you have a group home staff that they were told you have to keep eyes on the youth at all times, so they feel like they have to be in the exam room, and that's not the case. While they're in the exam room, they have the right to privacy. Now, a youth can request that whoever took them to the appointment, whether it be a social worker or caregiver, their CASA, stay in the room. That person might be a person they trust, and they're nervous to be alone with the provider, and they'd like the support, and they can request for that, but they would have to request it. All youth in California have the right to patient confidentiality regarding reproductive and sexual health services and records unless there's a written consent to disclose or through court order. And of course, the youth has the right to withhold consent to the disclosure. So what does confidentiality mean? What it means is if the youth receives reproductive and sexual healthcare services or asks questions about sex, contraception, or any of the related topics during a health appointment, the provider can't share that information with anyone without the youth's written consent. So they can't share it with the parent, caregiver, group home staff who took them to the appointment, social worker, anyone. Again, we see this a lot too, where the worker, the group home staff, think that they need to keep records of everything, and there's just some things that are covered and are confidential, and they're not required to know. Again, the youth can also ask the doctor before getting the care if they're going to maintain their confidentiality. And that's something that we also advise the youth. You want to make sure that you're comfortable with the doctor you're seeing and that they're going to keep your information confidential. Even though doctors should know a lot of these laws, when it comes to working with youth in the foster care system, there is some misconceptions and some questions as to how far the rights go. So those are all the rights I just described are rights of all youth in California, not just youth in foster care. The rights I'm going to talk about now are specific to rights of youth in the foster care system in California. A lot of these rights were slowly developed or came about to address some of the disproportionality that we talked about earlier. Also, our youth are very differently situated as far as the right to or their access to information and services and the supports they have. So these rights were put into place to make sure that we bring them up and provide them all the support and services that they need so they don't suffer the disparities, if that makes sense. So foster youth in California have the right to have access to age-appropriate, medically accurate information about reproductive and sexual health care, the prevention of unplanned pregnancies, including abstinence and contraception, abortion care, pregnancy services, and the prevention, diagnosis, and treatment of STIs, including the HPV vaccine. Now, they have a right to get this information. When we talk about the duties and responsibilities, you'll start to hear who is doing these things. Foster youth in California also have the right to be provided with transportation to reproductive and sexual health care services. This is the big one. This is one that we see violated all the time, where our clients are not able to get transportation to services. Not only that, the regulations, and I forgot to point out that all the slides underneath have the ACLs, the all county letters, issued by CDSS, who issues all regulations for the child welfare system. So you can always look them up. Just Google, CDSS, ACL, and the number, and I'll pop them up. But the regulation that talks about the right to transportation specifically says, and I've put the quote in here, that many of the services are time sensitive. Therefore, transportation has to be provided in a timely manner. So if we have a youth who needs, the morning after pill, taking them a week later is not sufficient. And we've seen, circumstances where they're like, sure, we'll take you, but we don't have a van that's available for 4 days, something like that. Foster youth also have the right to obtain, possess, and use the contraception of their choice, including condoms. And group homes, which there should probably not be any group homes anymore. Everything is now an STRTP. So STRTP staff can't confiscate a youth contraception as part of its disciplinary program. In fact, there's a very famous lawsuit which led to a lot of these regulations being issued. The Planned Parenthood versus PROMESA, where the group homes out in Fresno County were doing this. And as part of the settlement, we got a lot of these regulations through. So the regulations are very specific that this cannot be done. More rights for foster youth in California. They have the right to have private storage space and to be free from unreasonable searches of his or her personal belongings. And I think I covered this in the STRTP section, but with the new STRTP licensing guidelines, all youth are now supposed to have their own private locker space. It doesn't, it could be just a box. It could be a bigger. There's no description of how big it actually has to be. With lock and key that they keep with their belongings in their room, and inside that locked space, they're allowed to keep contraception. They're allowed to keep condoms. They're allowed to keep their birth control pill. They're even allowed to keep their morning after pill, or emergency contraception pill. This is very different from what it used to be. It used to be with the group homes that these things had to be centrally located with all other medicines. And as you can imagine, there's not that many youth who are going to run to the nurse on duty to get a condom when they're in the moment or in need. So that ended up being a huge barrier for youth in care. So now they're allowed to keep this all in their personal belongings. They also have the right to receive medical services and to choose his or her own healthcare provider of their choice. So if a youth, for example, wants to go to Planned Parenthood, or maybe they came into the system already having a doctor that they really like, they're able to choose the provider of their choice. Now, the only caveat to this is that they have to take Medi-Cal, which is all our youth qualify for, or else the youth would have to pay out of pocket for the medical services. But I normally go, in my bigger slide, I go over a little how these services are covered, but just know that in California, all of the reproductive health services that we've been talking about are covered under Medi-Cal or, oh my gosh, I'm blanking. I'm blanking on our state services, but they're all covered. So this should not, what I'm saying is this should not prohibit a youth from going to the provider of their choice to receive reproductive sexual health care services, maybe for another type of medical service. So the way we see this play out a lot is we have either a caregiver who's just, you know, has foster youth in the home a lot, and they have a relationship with a local clinic or doctor, and they'll always take the youth placed with them there. Or maybe an STRTP who has a connection to a clinic. Some of them have clinics like literally across the street from each other, and always take the youth there. It's fine if the youth is okay with that, but if the youth does not feel comfortable going to that provider or has the provider of choice, they need to be able to pick their provider. And finally, the youth in care have the right to independently contact state agencies regarding violations of rights, to speak to the representatives of the offices confidentially, and to be free from threats or punishment for making those complaints. So that is the state ombudsperson, community care licensing. They can make all the complaints they want, and they cannot be threatened or punished because of those.
There are a few questions in the chat really quick that I want to.
Yeah, let's go over, let me just do one more slide about just specific rights to LGBTQ and gender nonconforming youth, and then we'll be done with the rights of youth portion, and I can cover the questions if that's okay.
Perfect.
Just a quick slide. LGBTQ and gender nonconforming youth have the same rights as all youth, all foster youth and non-minor dependents. They have the right to be placed and live in out-of-home care according to their gender identity, regardless of the gender or sex listed in their record. So regardless of what it says in their birth certificate, if they identify as male, they have the right to be placed in a male facility. They have the right to access gender-affirming medical and behavioral care. Caveat to this is for hormone replacement therapy. If they're under 18, if they're over 18, they can consent of their own. If they're under 18, they need either parental consent, and if they don't have parental consent, they need the court to approve it. So we have at CLC had at least one case I can think of where the parent did not consent to the hormone replacement therapy. The minors, the youth's attorney put on a trial and put the youth on the stand to explain why he felt like he needed the therapy, and had the judge rule on it. And that's how we got consent for the hormone therapy. They also have the right to adequately train caregivers and child welfare personnel, and fair and equal access and freedom from harassment and discrimination. So that's all listed in state regs. Okay, let's go to questions.
There are two relatively short ones. One,
Sure.
Someone is wondering if the PowerPoint will be available after the training for review.
I believe so. I think everything's going to be available online, and we are actually recording this too, so it'll be available. But if for some reason you don't find it at the end of the presentation, it's my email. You just email me and I'll send it to you.
And then the second question is wondering what the name of one of the prior lawsuits that you were mentioning was. Their question is Planned Parenthood versus
Promesa, Promesa, and that was in Fresno County, and it was, I want to say 2016, but I might be off. And they sued the group home, the county, and the state.
Perfect. That's all for right now.
Yeah, and there was a lot more than just taking away contraception. There was like celibacy plans and, you know, contracts that they had to sign and things like that. But I say that just because that kind of was the beginning of a lot of these more recent regulations and laws that have been passed. Okay, so now you know the rights of youth in care. So who, you know, what are the adults, the social workers, probation officers, caregivers responsible for doing to support those rights or to, you know, ensure that they have healthy sexual outcomes? So some of the responsibilities of caseworkers, some of the responsibilities of caseworkers, aka social workers and probation officers, so that, you know, caseworkers covers them both. One is to inform the youth of their right upon entry into foster care and at least once every 6 months of the rights. And it's also very clear that ensuring the youth, informing them of the rights does not just mean throwing a pamphlet at them, but it's really ensuring that the youth understands the rights, that it's told to them and given it to them in the age appropriate, developmentally appropriate level so they understand it. They also are responsible for providing access to age-appropriate, medically accurate, and culturally sensitive information about all of the following topics. And I don't think, I know for a fact that, you know, the state did not envision that the social workers be experts in all these areas, but they need to be able to provide resources to the youth, give them access, whether it's, you know, buy them a book. There's a lot of really good ones out there. Refer them to a reliable clinic, local clinic, or there are some very good websites that have information. They're also responsible for informing the foster youth of the right to consent to sexual and reproductive health care. So they have to let the youth know that this was a right. You know, I covered what the rights were earlier, that this is a right of theirs. They have to ensure that barriers to services are addressed in a timely and effective manner. So some of the stuff I talked about earlier are considered barriers. And if that's the case, if there's a barrier to getting services, the social worker has to ensure that those barriers are removed. One of the most common one, which I talked about briefly, is one of the most common barriers that we see is transportation, lack of transportation, no one able to take them to whatever repro health service they may need. So social worker has to make sure that the youth has the transportation needed. And again, that doesn't necessarily mean that the social worker has to physically pick the youth up and drive them to their appointment, or although it can mean that, but you know, the social worker might need to ensure that the caregiver is providing transportation, or maybe talking to the youth, and maybe the youth says, you know, my aunt who I'm really close to, I want her to take me, but just to make sure that someone is providing the transportation. They're also required to inform the foster youth of their right to confidentiality and the written consent prior to any disclosure. So, you know, they have to let them know you have a right to keep this information confidential, and I can only disclose it if you give me permission and you sign this, but, you know, really go over all of their rights early on. Ensure youth are up to date on their annual medical appointment, and this is one that we see all the time being complied with, because the court reports and the information that they have to input, there's definitely a medical paragraph in the court reports and also in CWS CMS. So that's thankfully something that is mostly always covered. And finally, according to regulations, they have to ensure that their personal biases and or religious beliefs are not imposed upon the foster youth. Now, we know we all come into this work, attorneys, social workers, caregivers, everyone involved with our own background, our own beliefs, our own religious beliefs, biases. But, you know, the law is very clear that everyone dealing with the youth has to put those aside and, you know, work with them and assist them without these getting in the way. And I know internally at CLC, I know what is done normally in the child welfare office is, if for some reason your own internal, you know, your own background, your own beliefs could just not let you get there with a client, then that's when it might be time to, you know, transfer the case or have a supervisor step in. These are just some of the barriers to care that the social worker often has to make sure that are removed. I mentioned transportation early, but some other examples are that the youth is unaware of their insurance information, or they don't have a copy of their Medi-Cal card. They don't know how to schedule their own sexual health doctor's appointment, or maybe they're too embarrassed. Talked about transportation. The youth reports that the placement prohibits or confiscates contraception. That's a barrier to sexual health care and services. So a social worker would have to, enforce that right. Or the youth reports that the placement refuses to let them seek sexual health care at the provider of their choice, like they're being forced to go get seen at a particular office. And another barrier is when the regular provider doesn't feel trustworthy to you. So oftentimes, especially when we have like clinics that are connected or have a strong relationship with an STRTP, sometimes the youth feel like because there's such a close relationship and the placement sees, the nurses, doctors so often that they will not keep their information confidential, that their information will be shared. So they don't feel comfortable in those offices. And that might be one of the reasons that can lead them to seek care somewhere else. Okay, so that was caseworkers. Now we're quickly going to cover, I'm just checking in on time, yes, very quickly covering the responsibilities of resource families and STRTPs. For everything, including repro health, they must use reasonable and prudent parent standards to support the healthy sexual development of youth. So RPP, reasonable and prudent parent standard, was put into place to ensure that youth are able to participate in normal activities for that age group, that they're not being restricted from doing, seeing, or acting on anything just because they're in the system. So that is true for issues of reproductive sexual health. The caregiver can make a decision whether something is appropriate or not for the age, but they can't set more stringent restrictions, if that makes sense. They also have to assist the youth and or non-minor dependent to access healthcare services. They have to communicate with the social worker if a referral has to be made and they need help. They have to maintain the youth's privacy and confidentiality. They have to direct youth to reliable sources of information. Again, no one's asking a caregiver to be an expert on issues of reproductive sexual health, but they need to be able to direct them to information. To arrange for timely transportation to health-related services. So you saw this under the social worker probation officer section 2. So the caregiver is really responsible for arranging timely transportation. However, if it's not being done appropriately, then ultimately it falls on the social worker or the probation officer to make sure that it's happening. So that's really the way it breaks down. Oftentimes the social worker will have to call, like the STRTP and say, you have to make sure that you're providing transportation. And STRTPs must provide a locked storage container to all their youth so they can store the condoms, birth control, emergency contraception pills. We've talked about that. That has been newly added with the STRTP licensing standards. Really quickly, Senate Bill 89, which went into effect in 2017, is a bill that was co-sponsored by a few of our organizations that are participating and actually put on the conference LA Rep. It has two provisions. One of them was the requirement to document certain things in the case plan, and another one was the training provision. So the case plan provision is social workers are now required, and again, it went into effect in 2017, to document in the youth's case plan that the youth received comprehensive sex ed in school at least once in middle school and at least once in high school for all kids that are 10 years of age or older and non-minor dependents. And if they didn't get the comprehensive sex ed, what the agency is going to do to ensure that they do get the sex ed. And that's where, like we had a little session earlier about online sex ed education. This is why we're trying to develop these alternative ways of getting the comprehensive sex ed, because our youth in care are oftentimes missing out on this education at school. They also have to document all of the following things. I'm not going to read them out loud because basically these are not all new things that the social workers have to do, but the new thing is that they now have to document that they actually did it in the case plan. And that's to just kind of confirm that things are being done to ensure that the youth are meeting their potential in the reproductive sexual health care area. Now, really quick add-on, we recently co-sponsored another bill. It was like a follow-up to this bill that was just signed through the budget bill, which I'm very excited about. So just to let you know that starting next year, all of this documentation that was required to be done in the case plan will now be required to be done in the court report. So hopefully the judges, the attorneys will be able to confirm that all of the things are being done to make sure that the reproductive and sexual health care needs of the youth are met. And then I mentioned earlier, there was a training requirement to the bill, and caregivers, social workers, and judges were required to be trained on all of these topics. And I won't spend too much time on this because I really want to get to Lola. I want Lola to talk to you just a little bit. She is an amazing peer advocate for Children's Law Center. We're so happy to have her. She's also a foster youth advocate and a proud mama. So I will hand it over to Lola and then hopefully have a little time for some questions.
Thanks, Luciana. Hi guys, so my name is Lola. I'm a former foster youth and a peer advocate with CLC. I'm also a mom of 2 beautiful babies. I would like to share a personal story with you guys about my experience of some of my rights being violated when I was a foster youth. So when I was 13 years old, I was placed into a foster home that required their foster youth to use birth control in order to be placed with them. So I remember having a conversation with my foster mom that I wasn't sexually active and that I didn't need or want to take birth control. So when we got to the doctor's office, it was a doctor that she was familiar with, that she had been using for the last 10 years, so they knew each other very well. She mentioned that we were interested in the depot shot. So the doctor was explaining how often I would need to get the shot. And I just sat there and didn't really have a choice because I didn't really want to make my foster mom upset. And, you know, I didn't have any privacy with my doctor one-on-one or anything like that. You know, my foster mom stayed in the room with me the whole entire time. So while I was on the Depo-Provera shot, I had developed menorrhagia. As a result, I was in chronic pain. I was passing like blood clots almost daily, and I developed anemia. So in addition to that, I had become overwhelmingly like depressed and started experiencing like mood swings. So, and I could not like regulate my feelings like at all. So eventually I had moved home about a year later, and I started seeing a new doctor. So when we established that I was on the Depo-Provera and shot and that I was having these symptoms, she said, you know, that's common side effects of having that shot. So we discontinued it, and, you know, my symptoms relieved. I kind of wish that I never had to go through that. You know, if I had that one-on-one privacy with the doctor, I probably wouldn't have experienced those side effects. Or if, you know, my foster mom made that a comfortable conversation to have, I would have probably felt more empowered to make that decision for myself. So, you know, at 18 years old, I never attended a sexual health education class, and I never had an adult explain to me what sex was or what a healthy relationship was. You know, how do I address boundaries being broken, or, you know, being pressured to do things that I wasn't comfortable doing. You know, how would I even get access to birth control at 18 years old when I was homeless? So the most consistent person that I've had in my life was my social worker, and I wish she would have had those conversations with me so I knew better and I was more educated. So that is my experience that I wanted to share with you guys. Thank you.
Awesome. Thank you, Lola, for sharing your experience. You know, it's always, I can sit here and talk, but just to hear from someone with personal experience, I think goes a lot further. And fortunately, Lola is an awesome peer advocate and great mom, so she's been able to overcome everything. I went back to the chat to look at the questions. Yes, Family Pack, I was totally blanking because I was trying to get to all the information. Family Pack covers all of these services. So basically that means that a youth can choose any provider for reproductive sexual health care services because they will be covered financially. Another question that I saw was, hold on, let me go. What is considered timely for transportation to repro health appointment? It really depends. It depends what the appointment is for, right? If it's to go get an emergency contraception, then it's timely is a lot sooner. So it's really a case by case basis on what the need is, and also what the doctors, recommend, all those things. So I can't give you an exact time. I think I might have covered most of the questions. I don't know if anyone has anything else they have questions on. I'm gonna give you the last slide because it has my information, Laura's information. I think we're both very open. If you have any questions, you can always email us. If you don't, for some reason, get the PowerPoint and would like it, I'm happy to send it to you. Again, always happy to discuss these issues or chat about it. I often get emails from around the state about these concerns, which is great for me so I can see what's happening. What I didn't mention earlier is, for those of you who don't know, CLC represents all of the children in LA County's foster care system where they're court-appointed attorneys, Sacramento and Placer. And Lola's actually out of our Sacramento office, and I'm out of the Los Angeles office. So I'm very familiar with the issues in those counties and, from participating in state work groups, what's happening around the state, but always happy to hear from folks in different areas. And I think we might have just made it on time. I'm going back to make sure I covered everything, but I think I covered everything. There was a question about at any age or 12 and up, as far as the right to receive services without needing consent. Every service I mentioned is at any age. The only one that that is different in the law is treatment for, let me start. Like when I talk about abortion, all those things are at any age. The prevention, diagnosis, and treatment of STIs and HIV at age 12 or older. That's the only one that singles out in the law is 12 and older. The rest are at any age. Okay, I hope I'm gonna put it, oh, sorry guys, I went way too far, but I'm trying to put it back in my email in case you need it, and Lola's in case you need to look at it. Thank you guys so much for coming, and we will see you in another session. I'm gonna stop sharing my screen now.
Guys.
Hi, can I ask one more quick question?
Of course.
It's a follow-up to the timeliness of transportation.
Sure.
So are staff depending on the youth to communicate the time aspect of it to them? Because we have to respect their confidentiality, and we should, absolutely, with regards to those visits. But to get them there in a timely manner, how do we do that without knowing the timeliness of it, because we don't know what it's for? Does that make sense?
Well, right. And that's a conversation you have to have with the youth too. Like, I mean, if you ask the youth how urgent is, you can, if you don't feel comfortable asking specifics, and you can ask specifics and say, this is, I won't share this information, but just so I know, or you don't even need to go that route. You could just say, how urgent is this that you need to go, and just, I mean, I think the most open you can be with the youth about what their needs are, the better it is. And true, you might end up like rushing someone to a doctor where they could have waited a week, but what's the worst that can happen, right? Like, as opposed to waiting a week, not trusting that they really need to go, and then they needed emergency contraception. So I think that would be the best way, is to just ask, how urgent is it? What's I want to ensure that we have transportation available. We have to rearrange, I know oftentimes it's very hard, like you have to rearrange who's taking who, where, and how many, adults to youth at a time. Like I get all those logistical issues. So, maybe going over a little of that with the youth so you can make sure that they get seen in a timely manner.
Okay, thank you.
Yeah. Any other questions people have, feel free to email us, or any stories you'd like to share. Happy to hear it. Okay, thank you.